Hi, my name is Haley. I'm going to be your student nurse today. I'm going to provide you some privacy because we have a procedure that we're going to do. It's a foley catheter. Is that okay? Yeah? Okay, so I'm going to check your wristband and I just need your name and date of birth. Any allergies? Okay, matches in our MAR, and it shows that you had some pericare prior. Do you have any questions about the procedure? Okay. Well, it's just a procedure to help the urine leave your body. We put like a little tube in your urethra, and that'll help with your urinary retention. Okay, yeah, and nothing in the kit meets your allergies. So if you were concerned about that, that's a good. Okay, we're all set. All right, so we're gonna go ahead and get started. I'm gonna start by pulling the gown down, or the bedding, not the gown. Well, the gown will go up. Okay, all right. I'm going to start with your legs. That way they go a little bit wider because you're female, so we need a wide stance so we can reach the urethra easier. Okay, so I'm going to pull up the gown. I already got my packages. Everything's intact, not expired, and I'm opening it right now. Okay, if you have any discomfort, let me know, and we can stop. Okay. Washing my hands again. And are we ready? Yes? Okay. Alright, so I'm going to maintain my sterile field. Opening away from me, not touching anything that falls below the waist. Okay. And then we're going to have to put a drape down to maintain a sterile field in the area. Touching that 1-inch border. And I'm not putting my back to the field. I'm going to put this down so where I can reach a little better. I'm going to get my gloves, touching that 1-inch border as well. And I won't touch the inside of the packaging. They don't like to stay open. Okay. Only touching the inside of the glove because that's where my skin will touch. And I'll adjust the wrist later. I'll scooch in here, only touching the outside of the second glove so I can get my hand in there. And then I can, outside of the sterile, I did not touch that. Then we're going to set up the inside of our kit. Keeping the edge clear. I've left 2 inches for comfort. I'm going to squeeze my iodine on my cotton. I'm going to set up my sample kit. We're going to need that later. I'm going to put my sterile water into my catheter. We'll need that in a little bit. Some lubricant. And then, okay. So I'm going to maintain a dirty hand and a clean hand, and this is my clean hand. I'm going to pick this cotton ball up. I'm going to clean the outside first, maintaining that sterile field. Coming around. Inside. Not reusing a cotton ball because we don't want to introduce any infection. Okay, good, and I don't need those anymore. So my dirty hand, I like to clench it so that it looks, so I don't grab things with it. I'm going to carry this over the catheter, and I'm going to drop it into the sterile field so I don't cross that border. Okay, so dirty hand. We're going to want to find that urethra. It's going to be the top hole in there for us. Bottom hole is not where the urine is. I dipped this in lubricant earlier, so it should slide in a lot easier. And we're going to go ahead and insert that. Okay, so I see urine, so I'm gonna go in as far as I can, but like 2 inches minimum. And then, alright, so we're gonna push the water. We have 10 ml, so we're gonna put that in real slow. We wanna make sure that that comes out with us when we are done. Okay, so I'm going to get rid of my syringe, and I'm going to tug to make sure, gently, to make sure that it's in place, the balloon is inflated and it's not busted or anything. So this hand's still dirty, but the catheter is in, so I can break the sterile field and get my sample. Before I put it down below the leg, I'm going to sanitize this little spot here and for 15 seconds with an alcohol swab, and then I'm going to get my sample without leaving it down, of course. So we'll name, date, who, the patient, MAR, all their information to send to the lab for a sample. And then we'll tape this to the leg. We want to give it some lax so it doesn't pull around if they move or get up. And then we'll tape this below the body so that urine gravitates to the bottom. And then when we're finished, we'll clean the patient up, we'll get her comfortable and warm, and then I'll remove the catheter. If you want to beforehand, non-sterile, below you can get a sample here of urine. But I'm going to remove the fluid. You don't need this, it's no longer sterile. You'll remove the 10 ml because that's what was charted and that's what we put in the first time. Okay, so good. And that should come out nice and easy. There we go. This is all garbage. You don't have to have the gloves anymore. Maybe a regular pair, not sterile. Patient's comfortable. All legs in place. Bed is going to be in the lowest position for safety. And if the patient needs anything, go ahead and get it for them. And that is a Foley catheter insertion.